this one has, it's all self-contained, right? So it has the brush already in it, and then the fluoride is in this other well, but it's actually hardened because it's just old. I'm just showing you that it's there's two different ways that it could potentially be applied. This one's gonna come brush, separate little well with the fluoride in it. So we're gonna open it. This one's nice and white. So when we apply our varnish, we're gonna use one of our stone models, okay? It's really difficult to clean off of the Typodons, so trust us, you'll wanna do it on this. So we take it and we mix it, okay? It's gonna be the first thing that we do. And so you can see it's kind of that consistency I was saying of that, like Elmer's glue, right? So it's loose, but not super watery. So you can't really do this wrong. The way that the manufacturers will recommend you to apply it is basically in these two swooping kind of methods, or two motions. So you have a patient in, they're open, you're gonna take the buccal cusp, run along it, and it's gonna flow down, okay? And then you're gonna do the lingual cusp and allow it to flow down. So you might have them open and go buccal cusp all the way around, okay? And then lingual cusp all the way around, or you can do it in quadrants, kind of as you need, depending on how much is flowing down. That's ideally how you would do it, and it's gonna flow down, okay? It's not necessarily going to on the stone model. So you're gonna do it, and then you can kind of go back in and just make sure that you've covered all of the surfaces. You can get right into proximally. You can't do it wrong, okay? It just needs to cover all of the hard tissue surfaces, okay? So then you go in, but in real life, when you have a 2-year-old sitting there, you're not gonna wanna spend 1 to 3 minutes nicely making sure all of the teeth are covered. You're gonna wanna utilize the fact that it flows. Okay, and you're gonna wanna do that buccal, lingual, okay, and then a quick swipe, direct buccal, direct lingual, and you're good, getting it all on there, okay? Once it comes in contact with the tongue or the tissues or just saliva, it kind of creates almost like, it becomes less sticky. It almost is like a dried super glue. Otherwise, it's really sticky, so if it gets on their lips are gonna keep sticking together and they're gonna hate it, so be mindful of them, okay? Just try not to get it everywhere and anywhere. Like I have it on my fingers now because I didn't wear gloves and I can feel that it's sticky. So, what are our post-operative instructions for the varnish?
30 minutes.
No, 4 to 6 hours.
Yep, so we don't wanna eat anything crunchy or hard for 4 to 6 hours, okay? We don't wanna, sticky ultimately, yes, is one of them too. You don't wanna pull that off. You don't wanna have any hot or alcoholic beverages for 4 to 6 hours. And then you don't wanna brush for 4 to 6 hours or overnight, okay? So that's where they vary. So for the topical foam and gel, eat, drink, rinse, half an hour. Those are the rules. Fluoride varnish, gotta think more of that 4 to 6 hour thing, okay? You can drink, you can eat, but you need to avoid crunchy and hard foods for 4 to 6 hours, hot beverages and alcohol for 4 to 6 hours, and brushing for 4 to 6 hours. That's really important as part of your pass off. Huge, huge, huge. Like, that's like that will pass or fail you, ultimately. Those things you really need to know.